This is the Public Health and Safety Committee. We do have a quorum with myself, council members Benton, Bradford, Gregg, Huffman, Nash, Porterfield, Sepulveda, and Weiner. And then I'll add any others that come in. We have had no one sign up for public comment, so we will be moving forward past that part. Before I bring our guest up to speak today, we'll go ahead and run through our legislation. I offer a proposed consent calendar of everything that is on the calendar. And so first of all, let me ask if anybody has anything that they do not want to be on consent. Council Member Porterfield, you're recognized.
Thank you, Chair. Can we pull everything off of consent? I'm just kidding. I don't have any objection.
Okay, thank you, Council Member Porterfield, for your joke. All right, anybody else? Okay, then we'll go ahead and I'll read through everything and then we'll see if anybody has anything that they want to remove. First item is item number 2, RS 2024-648 by Porterfield, Evans, and others. Approves Amendment 1 to a grant from the Tennessee Office of Criminal Justice Programs to the Office of the District Attorney General to provide partial funding for 4 specialized victim witness coordinators to work with Spanish-speaking victims and within the Crimes Against Children unit. Item number 3, RS 2024-651, Porterfield, Evans, and others, accepts a viral hepatitis program services grant from the Tennessee Department of Health to the Metropolitan Board of Health to implement and coordinate activities and services related to the prevention, testing, diagnosis, surveillance, and linkage to treatment and other support services for individuals affected with viral hepatitis. Item number 4, RS 2024-652, Porterfield, Evans, and others, accepts a grant from the Tennessee Department of Health to the Metropolitan Board of Health to achieve sustained control and enhance prevention to eventually eliminate tuberculosis as a public health threat in Tennessee. Item number 5, RS 2024-653, Porterfield, Evans, and others, accepts a grant from the Tennessee Department of Health to the Metropolitan Board of Health to provide the Community Health Access and Navigation in Tennessee, or CHANT, program to deliver comprehensive care coordination services to eligible families and children. Item number 6, RS 2024-654, Porterfield, Evans, and others, approves an application for an Air Pollution 105 grant from the U.S. Environmental Protection Agency to the Metropolitan Board of Health for the ongoing collection of data on ambient air concentrations for fine particulate matter in Nashville, Tennessee. Item number 7, RS 2024-655, Porterfield, Evans, and others, appropriates a total of $138,700 from the Metropolitan Government Office of Homeless Services to Welcome Home Ministries for the provision of recovery beds for individuals with substance abuse disorders who are experiencing homelessness. Item number 8, RS 2024-656, Porterfield, Evans, and others, accepts a grant from the Greater Nashville Regional Council to the Metropolitan Government, acting by and through the Metropolitan Social Services Commission, to provide home-delivered meals, nutrition services for older or disabled adults. Item number 9, RS 2024-661, Porterfield, Evans, and others, approves 2 amendments to a grant from the U.S. Department of Homeland Security to the Metropolitan Government, acting by and through the Nashville Fire Department, to protect the health and safety of the public and firefighting personnel against fire and fire-related hazards. Item number 10, RS 2024-662 by Porterfield and Evans, accepts the terms of a cooperative purchasing master agreement for Panasonic rugged computer devices and accessories and Sierra wireless network equipment for the Nashville Fire Department. Item number 11, RS 2024-663, Porterfield and Evans, approves the sole source contract between the Metropolitan Government and NEC Corporation of America to provide automated fingerprint identification system, AFIS, upgrade, support, and maintenance for the Metropolitan Nashville Police Department. Item number 12, RS 2024-664 by Porterfield and Evans, approves amendment number 2 to a sole source contract between the Metropolitan Government and Higher Ground Incorporated to increase the value and extend the term of the contract. Item number 13, RS 2024-665 by Evans and Bradford, approves an agreement between the Tennessee Wildlife Resource Agency and the Metropolitan Nashville Police Department to issue boating law enforcement commissions to selected members of the MNPD. Do I have a motion? It's been moved and properly seconded. Anybody have anything they need to pull off before we vote? All right. I'll renew my motion. Let's take the vote. All those in favor? Anyone opposed? Anyone not voting? All right, thank you. You recommend approval on our consent agenda. All right. 10 in favor, 0 against, 0 not voting. Okay, we are going to transition into hearing from our guest today, Director Ashley Harrington from Metro Animal Care and Control is going to come up, and then we'll do department updates. You're welcome to come all the way up to the front. You don't have to hang out in the back. Everybody should have a handout on their desk from the council office that says MAC Updates 2023. So if you don't have one of those, please let me know. Okay. And Ashley, if you want to test that microphone real quick that's in front of you.
Can everybody hear me?
Yes,
All right.
perfect. And let me give everybody some context. So I got a chance to go meet with Ashley and Mr. John Finke. Am I saying your last name correctly? Okay, from that Ashley reports up to at the Metro Health Department. Had an opportunity to tour Animal Care and Control, hear about some of their pain points, which are familiar to many of you in this room, but also, you know, got to see a space surgery as I was walking through and those kinds of things. And then also have had an opportunity, of course, to be involved with animal care and control in my own district because, of course, I'm on all the rescue pages and all that good stuff. And sometimes as district council members, we're called on to support, you know, our city and our residents in those spaces. And so went to the Board of Health meeting a couple of weeks ago. Ashley presented to the Board of Health really good summary of 2023 stats. So I asked her if she would come and share the same information with the committee, take questions, and also speak to kind of some of the tough situations that we have, especially whenever she has to close access, you know, based on capacity issues, and take questions from the committee as well. So with that, I will turn it over to Director Harrington.
Hi, everyone. Thanks for having me out. So the handout that you were provided, if you could just refer to that, and I'll kind of go through what that looks like. That's the presentation that Councilperson Evans is referring to. So the areas at the very top are our intake numbers. In the yellow highlighted column, it shows our total intakes for last year as 5,002. So that means 5,002 animals came through our shelter. They were cared for by our staff. And the way those come in are kind of broken down, and that's the column you'll see next to the intakes tab on the left. So stray at large, we took in 4,221, and that could have been picked up by an officer in the field, or it could have been brought directly to the shelter by a Good Samaritan. We had 399 owner surrenders, so that's a member of the community who no longer could provide care for their pet. They brought it to us as an owner surrender. For those, we do require an appointment. We operate on a managed admissions platform, and that simply just means that the owner has to make an appointment to bring that animal in to surrender to us. Other intakes, that tab is usually generated by animals that were left outside the shelter. It could be tied to the bench out front. It could have been left in a crate out front. But there were 284 animals just left outside in the overnight hours. Generally, that happens. The outcomes tab, it's highlighted with green and an orange color. It's orange to me. The green tabs there are animals with a live outcome. So adoptions, ones that were reunited with owners that were looking for them. So last year we had a total of 1,948 adoptions, 1,021 animals, cats, dogs, and otherwise were reunited with their owners. And our rescue partners within the community, that's agencies like Nashville Humane, Wags and Walks, Proverbs, there were 1,122 rescue pulls. So that's very, our rescue partners and our relationships with them are very important to us. It helps more animals with a live outcome out of the shelter. Total live outcomes for last year were 4,101. Because we are the open intake shelter for Davidson County, we do have to euthanize at times. It's a you know, the sad part of sheltering, none of us want to do that, but it is still kind of one of those inevitable things. We generally only euthanize for behavioral reasons or medical reasons. We're not euthanizing for space, and I think that's evident at the capacity that we're at right now. Last year, we had 47 animals die in our care. And that's not to say they weren't receiving vet treatment. They were. It was just something that happened upon care. Sometimes they expire before our vet can fully assess or treat. Euthanasia-wise, we did euthanize 712 animals. Owner requested euthanasia. We assisted the community with 91 of those. And that's just somebody with, generally it's an age thing or a medical thing where the owner isn't able to provide that service for their own pet. Usually it's financial constraints, so we do offer that to the community. Those total other outcomes tallied at 880. The blue tabs at the bottom are our save rates, and they're just highlighted cat, dog, and then total. So total live outcomes for all animals out of the shelter were 83.93. Dog live outcomes were 87.16. I'm sorry, 82.67. Cat outcomes were 87.16. That's kind of just a snapshot of how animals come into our care and how they go out of our care. Does anyone have any questions on that? Yes.
Hang on one second,
Sorry.
Councilmember Bradford. Let me grab your microphone here. Go ahead.
Thank you, Chair, and thank you, Director, for coming and speaking with us. I understand the constraints and the situations that you and your staff go through every day. And kind of along those lines, can you provide any updates at this time as to where we're at with a replacement shelter, as well as some questions about these stats? You mentioned some of the owner surrenders, they leave them outside. Is there any kind of facility or structure people can leave their pets in so they're not exposed to the elements overnight? And then lastly, just a question under outcomes, you have lost in care. Could you explain what that one is?
Sure. Lost in care. I'll touch on that one first. It is weird. Stay with me because you're probably not going to grasp this fully. It's a weird nuance of our shelter management software. So when a rescue partner pulls an animal, if it's before the legal stray hold date, we have to outcome it as foster rescue, not as a transfer. And if that overlaps, and the reason they got stuck here is that that stray hold fell off after the calendar year changed. So they're not lost. I mean, let me take that back. We have had fosters who have lost an animal. So I believe there were 2 in 2023 whose a foster animal got away from a foster in the community. But the majority of those are not actually lost. It is that they were outcome to the foster rescue and it was updated after the calendar year changed. So it kind of freezes that stat with 2023. So it's updated to transfer after the stray hold falls off. We just want to make sure we're tracking everything in the system. And we have our IT department connecting with our shelter management, trying to work through it. They have not been able to work through it yet. So the lost in care is generally not lost. Update on where the new shelter progress is. We were allocated that money for planning. We have land identified, and we are trying to get the bid process up and going for some shelter architects. I do strongly believe we need somebody to build a new shelter who knows what they're doing, and that's where a shelter architect would come into play. What was your third question? I'm sorry.
About surrenders during outside office hours, like is there any way to protect them from that?
They're generally tucked up underneath the the overhang that's outside of the intake door. I know you know what I'm talking about. If you've not been out, please, any other members of council, please reach out and come out for a tour. I'd be happy to walk you through. But generally they are tucked up under there. Best place to suggest that. I think if we start suggesting that, we're going to get more animals abandoned in front of the shelter. Some forward thinking at a new shelter, they have devices that are kind of like the baby boxes at a fire station. There are those type of devices we could look at when planning a future shelter. That way there is some safeguard there from the elements.
I appreciate that. Thank you. And I definitely encourage anyone who has not toured the shelter, go out there and take a look and see what our amazing staff are dealing with day in and day out, and they still have a smile on their face. So thank you all so much.
Of course, thank you.
Thank you, Councilmember Bradford. I'll go to Councilmember Huffman next.
Thank you, Chair, and thank you, Director Harrington. First off, I want to echo my colleagues' recommendation to all members to go out and tour that facility. I went out, gosh, I think it was around November.
It was right after you guys took
Yeah.
your office, yeah.
That's right, yeah. And you right off the bat notice a couple of things. Number one, they're doing a lot with a little. And then number two, you get to see the constraints that they face on a daily basis. So thank you for everything that you and your team do, first off. Two questions. The first one, the intake number for 2023, 5,002, and I'm just looking at that general number there. How does that compare to previous years? Is it up, down?
So if you look back, I think I recently pulled stats for somebody that requested them. I can't recall who, but that's neither here nor there. We hit close to 5,000, I want to say like 2016, 2017. And then it dipped a good bit for the next several years, and then it started to take back up after COVID. And it's been on a pretty steady incline. Last I checked for this year to date, we were at just under 4,000. So I do expect us to exceed the 5,000 for this year once we hit the end of the year.
Okay, thank you.
Yep.
Second question, it's a stat that I know nobody likes to talk about, but it's something that I think will drive home the need for more shelter resources. Do we have any idea of the number of total animals turned away due to just constraints of space?
I do not. So we're not entering them into the system, so we're not able to track that accurately. Like yesterday and today, we were closed for intakes, and I believe yesterday there were about 10 people turned away. Today, when I left the shelter, I want to say there were about 5. Every day is different. So over the weekend, we had over 40 animals that were brought in, whether it was an owner surrender or a Good Samaritan bringing in a stray, or from the officers in the field. So we're reassessing every day, kind of seeing what we can, work with. Generally, we're not closed consecutive days. This morning, when I checked the intake numbers, we were at 151 dogs. So we didn't have any empty kennels, so we simply just could not be open for intake today. And that's not to say that we're not taking emergency things or things that are a matter of public safety. So we're still going out for those. We are reserving a small number of kennels for those. We don't broadcast that because then everything's going to become injured or aggressive. But those matters are still being, handled and fielded as appropriately and timely as we can.
Thank you very much.
Of course.
And I guess to that point, before I take Councilmember Bradford, would you kind of share a little bit more, I guess, about your process whenever, like if I were calling in or coming by because I had a dog or a cat, and you had to close the intake, what would the direction that you'd be giving to me as a resident?
Sure. So one, we would be asking you to what we call as a finder foster. And that just simply means that you're holding onto the dog through its stray hold, and we will fit you in as an intake in the most quick, efficient way we can. Sometimes that's a few days. Sometimes we've had instances where that finder foster turned into what we call a foster fail, and they've ended up adopting that animal. But we would provide all of the resources. So that's anything from its initial set of intake vaccines, flea treatment, food, kennel if you need it, and anything that would make that animal stay the easiest for you to assist us with. We do follow up. Our staff will call in the morning, reach back out when we have room. Generally, the finders are reaching out to us before we do get a chance to reach out to them. And we kind of, weave them in when we can. And it's very well communicated either when the person comes in person or on the phone. So
Thank you.
Yeah, of course.
Yeah. Councilmember Bradford, let me get you again. Hang on one second. All right, there you go.
Thank you. Sorry, I just remembered I had this one question. It's okay if you don't have the answer now, but if you just maybe send it to the chair and she can send it out. But basically, what is your cost per day per animal? And is there a way, or have you looked at when you have these weekends or months where you're waiving adoption fees, how much money that's losing us as a city? I've tried to make this point a couple of years as why we need to be investing in MAC, because when your shelter is full and you're turning around and say, for the next 2 weeks, we're not charging adoption fees, that's lost revenue that is ultimately hurting your bottom line and hurting our ability to give you the resources. So if there's a way for you to come up with those figures and send them out, I'd be curious to see about that.
Sure, I don't have, we do have a way to calculate that. I wasn't prepared for that question, so I didn't prepare that number. But I will follow up and send it to Councilperson Evans. I'll also include in there what we refer to as capacity for care. So it's calculated that each animal requires 15 minutes of care minimum per day. And then, dividing by staff, and that is what we should be staffing that building with, depending on how many animals we have, so.
Okay, we'll go to Councilmember Porterfield, and then we'll go to Councilmember Weiner. Councilmember Porterfield.
Thank you, Madam Chair. I don't have a question, just a very quick thank you for what you all do. I did get a mini tour of the shelter when I came and adopted my 2 rescue babies. So they just had their gotcha day back in April. I got them
very
2 years ago, and I did take advantage of the weekend where you all didn't charge fees. And it was really helpful in like buying all the other things that we like bought. It was like $500 to like buy up all the stuff for the pet. So it was like helpful to be able to get them during that time. But I was also able to see like all the work that you all do and just how good care that you all provide. So I just wanted to thank you for that experience.
Well, thank you. And if you do get a chance, please reach out and we can make that mini tour a full tour.
You too can watch a space surgery as you walk by.
There you go.
All right, Councilmember Weiner.
Yes, I loved the question when I was there. Sherry, do you get squeamish? Because we're fixing to go into surgery. So the answer was no for the record. But I highly recommend it, as has everybody else. It's a great opportunity. I have a couple of things that I want to bring up that just since we're in this opportunity for it to get out, let's talk a little bit about the spay and neuter program, what the limitations are to moving it forward, what we are doing in order to move that forward. And I think that it would be helpful for us to be able to, get that out there so that we understand here in the body and so the public understands what those limitations are and how we're trying to meet the need now and then move forward. And then the second question I'll have is to talk to us a little bit about the status of the staff additions that you were just provided in the budget.
Okay.
That's all I got.
Sure. So the staff additions, we received 1 ACO and 1 kennel assistant. They are posted and ready to be hired. They are in the process of interviewing. We do have some applicants. Some are quite good, some not so much. But they're both in the process of that. Staffing wise, in general, it's very much improved. I think on the kennel side, they are down 3 total positions as opposed to about 2 years ago, we were about half staffed with the whole building. I think a little less than half staffed. ACOs are short for 1 of those positions is an out-of-state applicant who's applying for the lead ACO. She's accepted the position. It's just that transition time and trying to accommodate an out-of-state move. The vet team is still short a full-time veterinarian. It's very hard to hire in somebody at the salary range that is there. So that's been vacant for about a year. That is a position you all granted us fiscal year 24, I believe. So that one's still vacant. We are interviewing. We just had an applicant apply. We interviewed on Tuesday. He did decline our offer. It was not salary. I think he's interested more in relief work. So we're going to try to get him in as a relief veterinarian to help offset our 1 full-time veterinarian's struggles. Our clerical department is fully staffed at this time. So we're plugging along, we're making progress. So thank you for those additions this fiscal year. They will definitely be much appreciated and, benefit the community. The spay neuter movement, a small update for the money that you all allocated for taking on some of the spay neuter in the community. There was $20,000 awarded to us, and we're partnering with the Pet Community Center. For the rest of this calendar year, they have some dates picked out on Fridays. They're opening, normally Pet Community Center is only open Monday through Thursday. They're opening on Fridays. They're going to promote it as a Fix Friday. So those dates will be September 27th, October 25th, and November 15th. In total, that will allow them to do around 90 surgeries, which is, a significant number of surgeries. That money will not be exhausted at the end of those 3 dates, so it will go over into calendar year 25. I have to get with Brandon, the director at PCC, and figure out the dates that we'll look at. He may revert to just adding an extra doctor on certain days. It's just going to kind of depend on their staffing availability. Regardless, the money would still be well spent and benefit the community. Friends of MAC, our nonprofit, is also adding some money in addition to this for the rest of this year. I think they are allocating around $7,000, and they'll try to increase that with the turn of the calendar year and, add some more money as well.
And Director Harrington, can you speak to, I guess, as far as those dates and everything, and kind of the tension between the Fridays and the potentially like the extension of the, day at PCC? Like, will that be something that PCC is communicating to the county, or will it come through you, or will it be both entities?
I believe it will go through the Pet Community Center. And I don't know if he's going to stay with the same fixed Fridays, but he'll communicate that regardless. And the reduced fee for that will be put out there by them as well.
Okay, very good. Let me get Councilmember Weiner.
So in terms of the spay neuter and some of the limitations that we've got, spacing, obviously that's a big one. And that restricts the ability of us to really spay neuter safely.
Correct.
Okay, so
Yeah. And this, please come out for a tour, because what I'm about to say, you're not going to understand unless you see it. We have the recovery space for 4 large dogs. We have to have the dog kenneled while it's in recovery. We don't have any space. It's not like we can line the hallways with kennels to have a dog in recovery. 1, that's traumatic, and 2, it's not very humane. But to operate a community spay neuter clinic out of MAC, you have many members of the community saying that it is entirely possible. We simply just don't have the space. And a lot of that is the recovery space. There's 1 doctor, again, who's doing that, 40 hours a week. And, generally he works more than 100 hours a pay period. So, adding that in addition to what he's already doing for the shelter animals that he's required to care for, he just simply doesn't have the capacity for that. There's been some exploration, trying to partner with other clinics other than Pet Community Center, and we haven't had any interest simply. There's a vet shortage, it's capacity of care for their staff, and it's, I don't think any other clinic has been overly interested to kind of partner with for that. It's not to say we won't continue to explore. If somebody's interested, we could explore, adding some more funding to that next year. But that's kind of where we are community-wise in regard to a clinic.
Are there other issues besides space and staffing that would factor into the concern for being able to do spay neuter now?
I mean, those are the 2 main constraints. It's just space and staffing.
And money.
And money, yeah.
Okay. All right, well, I appreciate it. Thank
Of
you.
course.
And again, everything y'all do is above and beyond.
Thank you.
Thank you.
All right, let me get Councilmember Gregg. You're recognized.
Thank you, Director Harrington. I cannot come visit you because my track record is awful. It's hard for me to leave without adopting. And I don't have the space in my calendar right now.
That's fair.
This is not going to be under your scope, but maybe you can help me. I've had several wildlife issues with neighborhoods, especially around the rivers in Donaldson. And they start with MAC and they're told to call the TWRA, and TWRA says there's nothing we can do. For example, I've got a pack of coyotes in a neighborhood that's attacked several dogs, and 1 dog had to be put down. And so the constituent feels helpless. Can you guide me of some place to go for guidance?
I mean, that truly does fall to TWRA. It's the Tennessee Wildlife Resource Association. That's a service that they should be providing. And I know that their constraints are staffing and resources and money. It's everybody's constraints. Our staff simply are not equipped to go out and wrangle a pack of coyotes. It's not safe for us. We aren't trained in handling wildlife in that capacity. And a lot of the wildlife calls that we will receive, if it involves a rabies vector, we aren't licensed operators. We can't go relocate that animal. So we would be faced with euthanizing a perfectly healthy animal because it was in someone's yard. There are options out there. They can call wildlife removal specialists. there is a fee for that, obviously. But, you know,
Yeah, I've called TWRA
Yeah.
myself, and essentially they said,
yeah.
there's nothing we can do.
Right. I mean, in the past, there has been, you know, we have been able to provide some assistance with that, but with handling our more routine calls, dog bites, aggressive animals, things that are posing a public safety risk to the community, you know, we don't have the bandwidth to take that on right now. It's a service that was cut a while back. But again, that should fall to TWRA.
Sounds like we need to get around the table and find
Probably.
a solution.
Yes, sir.
Mr.
I'd be
Sharp, did you?
willing to help.
I apologize, Councilmember Gregg, for cutting you off. Mr. Sharp, did you have a comment about TWRA? Oh, hang on just a second. There you go, you're recognized.
Pardon the interruption. We get that all the time. I mean, it is a frustrating thing. TWRA does maintain a list of, I think they call them certified wild critter removal people. Now, I don't know how serious that vetting process is, but that list is available for any local area on their website.
Thank you, Mr. Sharp. I know I had that experience with the Burmese python that was released in my area, and it was the same kind of thing. And of course, Ashley said, we don't have space large enough for that size reptile. And I got the same feedback from TWRA, and the feedback was, we're not going to commit to coming, and we're not going to commit to not coming. And I'm like, well, that does me no good. So maybe let's have a wildlife conversation, Councilmember Gregg.
Yeah, I've learned a lot about wildlife.
Yes. How about any other questions for Director Harrington? Councilmember Bradford.
Not a question, just a follow-up on Councilmember Gregg's as well. For any individuals who may be watching this tonight, I know, and they may not know, one of the resources they could try if they come across an injured wildlife is to reach out to Walden's Puddle. I know they are one of our local wildlife rehab areas, and they also, like everybody else, they have staffing issues, resource issues, because they are purely volunteer and donation-driven. So anyone who is interested in helping out, I'm sure they would love to have some volunteers and some donations.
There's another one called Harmony Wildlife too. It's based out of West Nashville, I believe. So either one are great options.
Yes, thank you. Any other questions for Director Harrington? Oh, Councilmember Jordan Huffman.
Not a question, but just a comment to the chair. Appreciate your efforts in keeping that python on your side of Hermitage. They're not allowed in District 14.
Thankfully, pythons know no boundaries. All right. Any other questions for Director Harrington? I would really encourage everyone to go and take a tour. It's really impactful, and I think this is a big issue. And I think for the next budget, you know, because there's kind of the competing tensions between, you know, folks that believe we only need a new shelter, folks that believe we only need to spay and neuter. The reality is we need to be doing both. And so we're going to have to collaborate with this council and figure out how we can move forward. So that way we can stem that pet population and at the same time make sure that we're supporting Ashley and her team who do such an excellent job. So thank you, Director Harrington, for being here today.
Thank you for inviting me out and let me take some of your time.
Okay, we do, before I get any department updates, we did have a resident who missed being able to sign up for public comment. And so I'm going to invite her to come back to, or come to the podium in the back, is Lisa Robeson. And so she wanted to speak about Metro Animal Care and Control. And so I will turn on the podium mic and then also start your timer, and you have 2 minutes to address the committee.
Okay, thank you. My name is Lisa Robinson, and I'm a native Nashvilleian. I live in Old Hickory. And thank you for letting me come and letting me speak, because we got into a little traffic jam trying to get down here. So I wanted to make just a few comments about Metro Animal Control. And the first thing I want to say is to thank you guys for running a really good shelter. Every time I've ever been to the facility, it's clean, it's well organized, it smells good. It doesn't smell like so many shelters do. The employees and the volunteers are nice and helpful, and they obviously care about the animals. And I have no complaints whatsoever about the way the shelter is run. And I appreciate that. I guess my concern has to do more with things that aren't that haven't been done in many, many years, long before Ashley was here. There has sort of been a neglect of ways to prevent animals from actually coming into the facility, out in the community, things we can be doing to reduce the numbers of stray animals and abandoned animals and so forth. And that would be mainly spay neuter. I guess I'm part of that movement, if you will. And what I did today is I brought some information that we have found of potential solutions on enhancing our ability to spay and neuter here in Davidson County. And I also sent some information to everybody by email day before yesterday, I think. But what we see, I use as, and I'll make this real quick because I know my time's running, but what we see as a model for this is in Sumner County, Gallatin, Tennessee, which is one of our neighboring counties, and the way they have run a very, very strong spay-neuter program for over 10 years, and the remarkable effect it's had on the numbers coming into their shelter and also being euthanized. So I brought that information. If someone could help me just hand it out to you guys, that would be great. Thank you. Thank you.
Thank you for being here, and thank you for sharing your feedback with us. We appreciate it. Okay, we'll transition now to any department updates. Actually, let's go ahead and go with the Office of Homeless Services first. And I did put this presentation from Mr. Clendenning on the committee members' desks. There are extras that are sitting on my desk if anybody's not on the committee. And actually, Mr. Hurrell, you don't have one because I skipped you, I'm pretty sure. But it's sitting on my desk. And so with that, I will turn it over to Mr. Clendenning from the Office of Homeless Services to give us an update.
Thank you, Madam Chair, and good afternoon. It's good to see everyone. I think our role for OHS really is to listen, and we want to make sure we do that. We want you to know that we do that. We listen to our community, we listen to you guys, and here we hear your voices. We take that into account, and I just wanted you to know that. So in addition to deploying Metro funds to assist with family housing, OHS is actively working to alleviate the stress on the shelter system. This includes placing full-time employees on location at the shelters to help reduce family homelessness. OHS has taken over the coordinated entry line for families, producing a system-wide access point for families. And the goal is to improve outcomes for our unsheltered population through strategic processes that increase, employment opportunities, housing options, and supportive services. Wanted to also hit on some good things that happened. July was a big month, notable things to celebrate. OHS, hit its 1-year milestone, as Councilman Huffman has pointed out in the past, and the grand opening of Metro Strobel House, that was another big one. HUD technical advisors were in town. They came to visit the community. They were there for the Strobel House grand opening. They sat in on community involvement meetings around a new CE assessment, and they offered guidance while they were here. It was a really good visit. The director of lived experience for the National Alliance for to End Homelessness, Albert Townsend, who's we're in partnership, was boots on the ground. He came here and visited as well, and he provided guidance for our Consumer Advisory Board and the community. And then just some stats from the monthly HMIS report. Just to note, the number of chronic homeless decreased in July, the number of homeless youth decreased in July, and the number of individuals housed increased in July. You have the report. I'd love for you to read the whole thing, but if you have any specific questions, be glad to answer them.
Thank you, Mr. Clendenning. Can you speak to, I know there were 3 of us this week that got emails or contacted specifically related to family homelessness and people that were having various stages of, in some cases outdoor experiences. And so can you remind the committee, I had to be re-educated about if someone it's a family member or a family with children, what's the process that they should take to be able to kind of get into coordinated entry and kind of into the system? Since you referenced it, it reminded me that I wanted to ask about that while you both were here.
Hello, Director Calvin, the Office of Homeless Services. So for families experiencing homelessness, the number to dial is 615-862-5600. 6444. It's a one point of entry, one point of contact entry for families experiencing homelessness. Unfortunately, the emergency shelter that we have on file is the Nashville Rescue Mission, and they're kind of at capacity. Even their new location is at capacity. So we're getting super creative on how to help decompress the shelter by having, that's what he was mentioning, by having staff placed there. I think they're short-staffed and a high number of families. So we have some coordinated entry staff there that's helping with getting documents, helping with some case management, providing wraparound resources, coordinating how to bring in outside resources to help the mission with moving people out a little bit faster.
Okay, that's very helpful to know. Let me recognize Councilmember Porterfield.
Thank you, Chair. Is there any way that we could get, I mean, I think that's like super helpful for us, like here in committee, but the rest of the body obviously isn't in here, like maybe a flow chart or just some type of graphic so that when we're in these situations, we kind of know like who to reach out to, because sometimes, to Councilmember Evans' point, you know, sometimes it may be 9 o'clock at night and maybe we stumble upon an unhoused person at Waffle House or Walmart, or someone may give us a call, and, you know, we don't always want to call you, and we appreciate you being accessible to us, but we also want to respect your working hours and you needing a break and not wanting to call you all times of night. So I think if we just had some type of like document or flow chart that would help us, that one, like we can share with the community, but also so that we know when we run across individuals that are unhoused and unsheltered that need some help, we'll know what direction to try to send them to.
Absolutely. We will get that to you all within 2 to 3 days.
Thank you, Director Calvin. And can you, what are, as far as the hours of the phone number that we have, what, is it regular, like 8 to 4:30 kind of hours? Okay.
Currently, it's 8 to 4:30, and we're just monitoring the data to see how many calls are coming in, if it would be beneficial to have someone on call at nights or weekends. And this is our second month of operating that phone line, so we're just reviewing the data at this point.
Okay. And then kind of as a follow-up kind of to that point, I appreciate whenever I go, I have no information. Let me try to connect you. And to that point, it's not a great process because then we're contacting you at weird hours or via email or whatever. And so with that particular phone number, can people leave messages on that line and then somebody will call them back?
Yes, ma'am. It is
Okay.
a voicemail.
Okay. And then let me think if there's anything else I wanted to know about that number. Oh, I guess I also don't feel like I have a good grasp on maybe some of the individual, and I know you're not in control of nonprofit partners and kind of their processes, but like, you know, the situation that I was experiencing where it was, you know, the person in domestic violence, location, you know, that was saying that her, you know, shelter was going to be ending. I don't know how we can get more information specific to like individual nonprofit practices and kind of what those look like from a high level. And I don't know if you'd be the best person to funnel that request to nonprofits or if it's something that should come to like the HPC or what your recommendation might look like.
I think that was one of the important facts for Councilman Huffman's bill. So even Shelter Committee tasked our team with that just last week. So we are gathering that information, and we have through our coordinated entry line, we're really focusing more on prevention and diversion efforts as well. So we have a comprehensive list. It may be too robust to surface, but maybe, I think there's over 300 data points there. Another important tool is the Where to Turn for Help guide, and we can make sure to distribute that with you all. Metro also funds the digital format of Where to Turn for Help. So there's a lot of different areas where that type of work is living, but I think for emergency, it may be really beneficial to have a one-pager that we can help with circulating.
Okay, I appreciate your help with that. Any questions for Mr. Clendenning about his report or Director Calvin while they're both here? Okay, I feel like everybody's informed then. Thank you very much for being here. How about any other departments that need to speak on anything? Mr. Sharp, do you have anything you need to share? It looks like everybody else left. So other than health, thank you, health, for staying all the way through. So with that, if there are no other questions or comments from the committee, we will consider this meeting adjourned. Thank you.